Well, welcome back, everyone. We've now come to our keynote address, and Dr. Kurt Newman, the President and Chief Executive Officer of Children's National Hospital, will introduce our keynote speaker, Governor Ralph Northam of Virginia. Dr. Newman.
Thank you, Dr. Badshaw. It's great to see everybody, and I know it's been a terrific conference, day one of our fourth annual Children's National and the National Institute of Allergy Infectious Disease Symposium. Apologize that we have to be doing this virtually, but I look forward to being back with all of you in person next year. Our alliance and partnership with the National Institute of Allergy and Infectious Disease, it's a strategic and novel alliance, and it really benefits children everywhere, and I'm proud of this unique partnership. It's enriched the research and the care, both at Children's National and at the NIH, and so it's terrific to hear all of these great presentations on the forefront of medicine and pediatric medicine in particular. It's a particular honor to have with us today our keynote speaker, the 73rd Governor of the Commonwealth of Virginia, Ralph Northam. Although I like to call him Dr. Northam because I think, that's his true essence is as a physician, pediatric neurologist. He was a native of the Eastern Shore, educated at VMI, the Virginia Military Institute, where he graduated with distinction. And after he was finished college, he was commissioned as a second lieutenant in the United States Army and served 8 years of active duty and rose to the rank of major, and that's no small accomplishment. He attended Eastern Virginia Medical School, one of the great medical schools in our country, and then traveled to San Antonio for his pediatric residency. But probably most significant, he met his wife, Pam, there, who's a pediatric occupational therapist, and just a terrific professional. Governor Northam did his residencies at the Walter Reed Army Medical Center. And I think what's one of the things that's notable about that, maybe he'll tell the story. If he doesn't, I will, was that part of his rotation was to come to Children's National, where he was part of the neurology service. He did have a little foray into neurosurgery that he might want to tell us about. But he established a lot of his relationships and learned about pediatric neurology at Children's National. We're proud of that. And then served as chief neurological resident at the Johns Hopkins Hospital. Served in Germany and treated soldiers that were wounded in a desert storm. And, it just having been Memorial Day, we want to thank you, Governor, for your service and all the people you cared for, all the soldiers. He's a pediatric neurologist and, practiced for many years at Children's Hospital of the King's Daughters, and then established a clinical group, a specialty group, to provide expert pediatric care for patients. And I could go on and on about his achievements in tackling some of the most toughest diagnoses in hospice, end-of-life care. There wasn't anything that he wouldn't tackle. Early in his, as governor, he came to Children's National and gave grand rounds, and it was spectacular. It inspired a lot of young residents to think about careers in public policy and making contributions. And I think one of the, a very inspiring moment for me was I had invited him to our new campus, our Pediatric Research and Innovation Campus, where he had served as a physician, and he saw what we were doing to transform that campus to research and innovation. And Governor Northam, I'm proud to say it just opened up, and we got to get you out there now to see what's actually happening on that campus. with Virginia Tech moving in, J-Labs, and everything that's going on there. But I could go on and on about my great friend and just terrific leader, but I think I want to turn it over to you now to share some of your thoughts about the pandemic, the impact on children in schools. Thank you, Governor.
Wow. Well, thanks, Dr. Newman. And it's great to be with everybody. And it sounds like you all are having a great symposium. And, you know, the National Institute of Allergy and Infectious Disease and Children's National have such wonderful reputations. And for you all to collaborate and do this together is just amazing. And so I really thank you for the opportunity. Dr. Newman, if it's all right, I'm going to call you Kirk because we all are good friends and we go back a ways. But, you know, I did, as you said, I've trained in a lot of different places. And I did several months of neurosurgery training at Children's National. And I just have to say it was my best time in my training. And I have such fond memories and I learned so much. Just a quick story, and I know Dr. Newman has heard this before, but when I started the rotation as a child neurologist, there were 2 neurosurgery residents. And the plan was that after I got a bit comfortable and the hospital was hopefully comfortable with me, I would be in the rotation of taking primary call at night. The attendings was Dr. George McCullough, who's no longer with us, unfortunately, but he lived very close to the hospital. So that was the intention. Well, the first day I was there, one of the neurosurgery residents came down with a very severe illness and was out of commission for several weeks. And so it was me and one neurosurgery resident, and we took call every other night. And the way I'll describe it is it built character, but it was a very busy time, but again, just a wonderful, wonderful place to work. And Dr. Newman, I just wanted to commend you on your leadership there. As you said, I have been there a couple times, and I've seen the hospital mature and grow, and just they're very fortunate to have you as their leader. So it's good to be with you. I know we all wish we could be together in person, but while the COVID pandemic has made that difficult for now, we do have some good news, I think, in the country, and especially here in Virginia. Our case numbers are plummeting while our vaccine numbers are marching upward. And we're truly seeing the light at the end of what has been a very long and dark tunnel. And I'm not going to get political today, but I want to just tell you a little bit about how things have been as a doctor and as governor. And it's hard to believe now that our first case of COVID in Virginia was March the 7th of 2020. And what a ride it has been since that time. We literally had no idea then what we did not know about this disease are the challenges that we would face in fighting it. And with no clear national leadership at that time, governors, we literally were competing against each other. I know you all remember the PPE shortages that we had and testing supplies. And just to put that in perspective, to tell you, how far we have come, we were able to do several tests a day at the beginning of the pandemic. And the only place, we had a lab here in Richmond, but the only place really to send those tests was to the CDC in Atlanta. And the turnaround time was like 10 to 14 days. And, it's for those of you that are clinicians, that doesn't do anybody any good. And so we have come a long, long way since the early days of the pandemic. And while we've seen since the beginning that outcomes for COVID are certainly poor in the older population, and especially those with pre-existing conditions, we could not have predicted that it would lead to some cases of the MIS-C in children. And I know you all have talked about that during this symposium. Thankfully, as you all know, if that's diagnosed and recognized early and treated appropriately, the prognosis is fairly good. But this virus and the pandemic have affected children in many ways, and not just those who became sick. In Virginia, we decided early in the pandemic, back in March of 2020, a very, very difficult decision for me, but that decision was made to close schools. And we also issued a stay-at-home order. We knew it would affect many people, such as businesses, and it has really been tough on certain industries in Virginia, and it's not unique to Virginia, but especially the hospitality industry, restaurants, hotels, entertainment venues. On the other side of the coin, some businesses have done very well, and we've worked hard in Virginia to diversify our economy. Our revenues at the end of April actually were up about 40%, which is something a problem that a lot of states would like to have, but they were up 40% from April of last year, and obviously that was pretty much pre-pandemic. So overall, we're actually doing very well in Virginia, and we're doing everything we can to make those industries, the restaurant industry, hotels, et cetera, whole through some rescue care money that we'll apply to them. But our goal through all of this, and especially as a doctor, was to save lives. And, I think really it worked. And Virginia has consistently had amongst the lowest numbers of cases and deaths in the nation. And while there have been over 10,000 deaths, we have tried as best we can to keep that as low as possible. But we also know that our children suffered from the decision to close schools. No doubt about it. There were equity issues in access to healthcare and also in access to learning. This pandemic put a spotlight on health inequities that really have existed for decades. And it has highlighted economic inequities and the fact that where you live makes a difference in how you interact with the world. Now, I want to give you one example, and that's broadband access. During this pandemic, having access to the internet has been critical for telehealth. And just an aside, it's interesting. I started a medical practice back in Hampton Roads back in the mid-90s. And obviously, all of our patient contacts were face-to-face, in person. Well, now about 75% of them have been through telehealth, and which has worked well. It's a different learning curve for a lot of us that have been practicing for a long time. But can you imagine if you don't have access to healthcare, you have no access to telehealth? And it's also been extremely difficult for parents to work as their offices move to virtual meetings and for children to attend classes. So if you can't afford internet access, or you live in an area, mostly our rural areas, where broadband just doesn't exist, this pandemic was a lot more difficult. The pandemic truly highlighted how our broadband access gaps impact people. And while we've worked on that issue throughout our administration, it really gave us a kick. Virginia is committed to expanding broadband, and we have budgeted about $50 million in each of the next 2 years to do so, in addition to $30 million in federal CARES Act dollars that we've devoted to broadband access. We're also planning to allocate some of our American Rescue Plan funding to broadband. So these resources can help close that gap for rural or low-income families, and again, finally help us get to what we call that last mile. We also have learned and know that the safest place for our children is in school. In the past year, pediatricians have started seeing more mental health issues in children, more anxiety, depression, and even suicides. Clinicians have written more prescriptions for stimulants, for anxiolytics, and also antidepressants. So as we move forward back to a more normal life, we'll need to keep an eye on these children and make sure that they continue to get the support and treatment that they need. Children are often resilient, but this has been a great deal of change and uncertainty in a very short period of time. we don't know what the long-term impacts will be. Schools provide stability and structure. While we know children need to be in school for their educational achievement and for their mental health, it has taken time to make families and school staff comfortable with greater in-class time. And what has happened in Virginia, and again, I don't think it's unique to just Virginia, but when we look at how people have approached the pandemic, there's certainly a spectrum. And for the pediatricians, perhaps you can relate to this, and I often would teach this to our students and residents, but on one end of this spectrum, we have Munchausen's by proxy where everything is wrong. And on the other end, we have total neglect, and in between, a lot of different other approaches. And it's been the same with this pandemic, interestingly, there, and some of it, unfortunately, has been political. But on one end of the spectrum, there are people that don't even think it exists. They don't even think the pandemic's there, don't need to wear a mask, don't need to get vaccinated, etc. And on the other end, there are people that are literally afraid to walk out the front door and go get the newspaper, and then a lot in between. So in trying to get our schools back open, there's some people say, let's go. And there are others that say, no, we're not ready and it's not safe. And again, a lot in between. And so again, as an aside, it's been very difficult in decision-making, keeping everybody content, because people are literally all across the board in that spectrum. So anyway, I thought that you might find that interesting. But throughout the past year, we have really tried to work to balance health with safety, offering guidelines for cleaning and distancing, supporting schools as they work through issues of in-person versus virtual learning, and directing federal relief funds to schools and localities to support students, families, and schools. We're also helping support schools that want to provide extra days and extended learning opportunities to help our students catch up that need that during the summer months. And we have really prioritized vaccinating our teachers. They were at the top of the list. And so our goal is to have all in-person learning this fall. That is where our children need to be. And as I said earlier, that's where we know our children are the safest. We expect that we'll include the sports and competitions that students and their parents enjoy. Those sports, as you all know, also provide social contact and structure that children desperately need. Throughout the past 15 months, I have done everything I can to follow the data and science to help make decisions. And I just want to say that it is great to have a partner in Washington now who believes in science and doesn't think that infusing disinfectants or using ultraviolet light is the answer. In Virginia now, we're seeing fewer than 300 new COVID cases per day. Today we had close to 200, yesterday 59. So as I said earlier, the case numbers are really plummeting, and it's because of vaccination. So 67% of adults here in Virginia have had at least their first dose, and 56% of Virginia adults are fully vaccinated. I'm also encouraged by the response of families and children aged 12 and above now that they are eligible to be vaccinated with the Pfizer vaccination. We're really looking forward to FDA approval for younger children. And something I thought you all may be interested in for planning purposes, about 6 weeks ago, I worked with VCU, which is Virginia Commonwealth University here in Richmond. And we did a survey asking parents that if and when there's a vaccine that is safe and effective, how many families would be interested in vaccinating their children? And I was pleasantly surprised. For those 12 and above, it was about 63%. For younger than 12, a little bit lower at around 60%. But I thought that was a good number. And so we've had a good response so far. And as you all know, the outcome, as I said earlier, is much better in children when they contract COVID, but they're vectors. And so in order to get as close to we can to herd immunity, it's really important that we get our children vaccinated as well. So that's what will help us finally put COVID in our rearview mirror. So I don't know about you, but I'm looking forward to finally getting rid of these masks. While Zoom calls such as this are a good way to go, I'll be glad when we can stop Zoom calls, and also I'll be glad to not be told repeatedly to unmute my computer. I would tell you, if I had $1 for every time I've been told I'm on mute, I think I could retire today. So, Kurt, I want to thank you for allowing me the privilege of speaking with you. I realize I'm probably the only thing between you all and cocktail hour, so I didn't want to talk for too long, but hopefully I've been able to give you a little bit of a perspective of what it's like to manage a state as a doctor during the pandemic, especially with my background in pediatrics. But I know there are a lot of clinicians and also a lot of scientists on this call, and I just wanted to thank all of you who have helped during the pandemic, that have been part of developing the vaccines, which I just think is so commendable, and have been part of the solution to literally save lives and to end this pandemic. We've all learned a lot, and I think we'll all be glad, as I said earlier, to have the pandemic in our rearview mirror. So, Kirk, thanks so much for allowing me to just spend a few minutes with you all. Again, I hope that in the near future we can all be back in person. I do think there's light and hope at the end of the tunnel, but in the meantime, to all of you, stay safe and healthy and keep up the great work, because, as I said, you all are touching a number of lives, and that's certainly something we all appreciate. So, Kirk, thanks, and we'll see you soon.
Governor, thank you. It's just a terrific talk and get a inside look at all of the issues and how your leadership and your leadership team were there from the beginning. People may not know that every Friday morning you had a phone call with all of the healthcare leaders and hospital leaders, and I was lucky enough to be included in that, where we could not only coordinate the care and the approaches, but also bring up-to-date frontline information to you and your team. And I think that's part of the reason that the results have been so good in Virginia. When you look at the way the vaccines were distributed and the testing was ramped up, or just all of the different approaches to a really set of complex issues. The focus on disparities in populations and communities that were harder hit, and I think the results show. And we've been honored to be a part of that. Of course, we care for lots of children and families in Virginia with other hospitals or directly because of who we are. And I think for the attendees from the National Institutes of Health, the NIAID, the partnership that we have with you all in so many research projects, and I know there's a big project to study children, the long-term impacts of COVID as partners in that. And the governor, as not only as governor, but as a pediatric child neurologist, has highlighted the lasting impact on kids and the impact of not being in school, or the mental health crisis that we're all facing and that we need to work on together. So it's just been great to have you speak. We look forward to having you come back to Children's National in person, and also your old stomping grounds out at Walter Reed to see what we've put together in terms of a campus for research and innovation. I know Dr. Fauci and Dr. Cliff Lane, who are the leaders of the NIAID, are joining with me in thanking you for being with us today and sharing your thoughts. And again, we look forward to seeing you soon. Thank you.
Yes, thank you so much.
Thank you again, Governor. And I'd like to welcome all of you back tomorrow morning at 10 a.m. Eastern Time for the second day of this symposium. So until then, have a good evening. Bye.